Well, initially when ASA was founded, it was founded as a response to gay-related infectious disease at that time. People didn't know what was happening in the community, and we saw people that were dying from this unexplained illness. The goal now is really to help people live healthy with HIV, and that's for those that are positive, and for those that are negative is to keep them HIV negative through multiple prevention strategies.
When I first went to ASA, I had an issue with my dental, and they referred me to Jackson Clinic. So they've helped me out in a lot of ways, and it has a lot of meaning to me.
We saw about 1,200 patients last year. This new clinic has the capacity for 1,600 patients. We have the full range of services, fillings, crowns, bridges. We operate here on a sliding fee scale based on the client's income. So anyone can come here, and then we decide based off of their income what their sliding fee scale would be.
I started talking to my case manager about it, so they referred me to Jackson. And basically I went in and they started the process, and they did the cleaning, and it was like real fast miracle. I'm talking about, it wasn't even like a month and a half. It was just like week for week I went in for them to do a different procedure, and like I say, about a month and a half I had my teeth.
I've been involved with ASA since we came back to Austin in the mid-90s, so over 20 years. I first was with ASA as a client, and very soon thereafter became involved as a board member, and after a couple of years became the chair of the development committee, and spent several years raising money for AIDS Services of Austin. In the process of doing all of this, learned how much their services are needed in the community. It's also a fact that today over half of the clients of AIDS Services of Austin are over the age of 50. Recently I've become involved with Primetimers, the organization for older gay men, and we took it upon ourselves to raise money for the most recent AIDS walk, and we wanted to make that as good a performance as we could do, in part to show the community that aging is not something to be afraid of either, and to remain vital and relevant in the community. And so the two organizations are beginning a dialogue about the special needs of AIDS patients who are aging.
We're out there in the community, we're out there working with partners, other organizations, businesses, with people. We're doing street outreach, we're working with hospital systems, and I think we're keeping it on the forefront. And so we're able to overcome that barrier, and we're every day working on that so that people know that this is still impacting our community.
The good thing about the drugs that are out now, the protease inhibitors that have been out since the end of the 90s, is that they are helping people live longer. And so now we're seeing folks, we're seeing something that we never thought we'd see, which is people aging with HIV. What's happening with that is that, like everybody who ages, they're living with a chronic disease, and then they're getting other diseases. But as it manifests with HIV, it's really become more complicated.
He came out and told me he was HIV. It was devastating. Because if I wouldn't have had ASA, I wouldn't be able to survive and to deal with his situation.
Most of the clients we serve, this is the only way that they get access medical care. So most of them are at or below the poverty level. They either, in a state like Texas, may not qualify for affordable health care or the marketplace, since we didn't expand certain coverages. And so really without ASA, they're looking at significant hurdles or barriers to care, and the impact that we make on folks, it allows them to reclaim their health. Working with ASA, it's a privilege. I don't get the Sunday night blues because I feel really good about coming to work every day. And that doesn't mean there's not stressful days. It doesn't mean that there's not days where you don't get accomplished the things you set out to do. But I've never left this building thinking that was a day wasted.
As an employee, it's a place where I get to learn safely and learn how to be a professional, and the management here has been really supportive of that. As a person, it means I get to learn more about fellow people, And our clientele is really amazing, and they've taught me a lot about resilience, about grace under pressure. Yeah, it's really a safe place for employees to learn how to be good employees, for clients. I also work a lot with volunteers, and I do my best to make it a valuable experience for them too.
I get to actually get out and help people understand things. And I learned a lot of things that I can tell other people, and I can actually have a group of people that I can talk to.
I've had so many networking opportunities and met so many people and gotten to experience so many different events and outreach opportunities I might not otherwise have been privy to beforehand. So it's definitely opened a lot of doors for me.
I think in working with AIDS Services of Austin, it's a family team approach in terms of people that are committed to really impacting the community through serving people affected by HIV. I'm very fortunate to be working with a team of people that do the great work in the field every day.
AIDS Services of Austin is a wonderful example of how a community can come together and respond to a terrible situation. And in the process, people involved learn that what's really important in life is how we do things, how we respond to issues and problems, and what we can do for others to make it right. It's in the doing that we get meaning in life.
There is so much help out there. There's so many educational opportunities out there. There's just so many things at the end of the day that you can get yourself consumed in terms of getting involved in some sort of capacity at ASA, whether it's through volunteering or coming to some of our events, or even joining on as a client because you need services. And I would say just overcome that fear, take that first step, and get involved.